Good morning, everyone. I'm speaking to you today on the territory of the signatories to Treaty 7, and I'd also like to acknowledge the Métis people of Alberta who share a very, very deep connection with this land. I'm joined today by Ashley Stevens, who is a Medicine Hat resident who's been diagnosed with multiple sclerosis, by Holly Turnbull, a Medicine Hat mother of 4, and by Mariana Ajacek, Executive Director of the Samus Immigration Services Agency, that is located right here in Medicine Hat. Right across our province, Alberta families are living through a crisis in healthcare. Under the UCP, dozens of rural hospitals have partially closed. Emergency rooms are overwhelmed and ambulance wait times have never been longer. Almost all of these problems can be traced directly to the shortage of frontline healthcare professionals, nurses, paramedics, and doctors. Your family doctor is supposed to be your first and best option when it comes to maintaining your health. And that's why, in fact, it's called primary care. But today, hundreds of thousands of Albertans across this province don't have access to a family doctor. We know that here there are currently no physicians who are accepting new patients here in Medicine Hat. And the total number of physicians in this city has dropped by 20% over the past 2 years. The people of Medicine Hat have nowhere to go to ask about those smaller medical problems, the ones that, if they aren't addressed, subsequently develop into much larger medical problems. They have no ongoing relationship with the doctor over the years, none of the continuity of care that's so important to staying healthy or to managing a chronic condition. And now, we do know and we understand that there's a shortage of doctors right across the country, but only in Alberta has the provincial government been so openly hostile and so intent on chasing doctors and other frontline healthcare professionals out of their clinics, out of our hospitals, out of the province. Alberta families have paid the price for the UCP's war on healthcare workers and healthcare. Now, there is a deal that's before doctors right now, and voting on that contract carries on until tomorrow. But let's be clear, it has been the better part of 3 years where there has been no contract in place. And it has been 3 years full of fighting, misinformation campaigns spurred by the government, and an overall lack of focus on improving patient care. Moreover, even if a deal is reached, many doctors are going to wonder if it's worth the paper it's written on, given that the reason they're in this position started when this UCP government broke their word to doctors and ripped up the original agreement. At the end of the day, it is patients, those families here in Medicine Hat and across this province who are looking for access to a doctor, who are paying the price of this kind of mismanagement. And for more on that, I will turn things over to Mariana.
Thank you, Rachel. At Samus Immigration, we provide settlement services to hundreds of newcomers each year. When coming to a new place, whether it's a new city or a new country, one of the first things that people are looking for is a doctor. Over the past year, our settlement workers have struggled finding doctors accepting new patients. Right now, we have about 100 clients who do not have a family doctor. Without a family doctor, our clients have only 2 choices for their medical needs: the walk-in clinics or the emergency room. Neither are good solutions. And we are hearing of the same issues from our counterparts in Lethbridge, Calgary, and Edmonton. The walk-in clinics, while providing a great medical care, are not able to build a rapport with the patients. Each time the patient visits the clinic, there's a new doctor and no follow-up. The emergency room is also not a viable solution because both our clients and the ER staff are unhappy to see the emergency services clogged with what should be a routine visit to a family doctor. For our clients, there's also a language barrier. Our staff has been able to build a relationship with office staff at family doctor offices to ensure the interpreters are at appointments and communication is workable. If we are able to send an interpreter volunteer with the client to the ER or walk-in, the volunteer and the client will sit for hours waiting to be seen. Medicine Hat is a tight-knit community, so service agencies work together. We know that organizations that serve other demographics are also seeing the strain of the healthcare system. Their clients are also unable to find a family doctor. We simply cannot understand why there is such a large gap in the primary care in Medicine Hat. Doctors are leaving, they're leaving the city, they're leaving the province, and we feel that something must be done to recruit and retain doctors in the community.
Thank you very much, Mariana, for those insights. And now I'd like to introduce Ashley Stevens to speak about her experiences as an Albertan who is living with a chronic medical condition.
Thank you, Rachel. My name is Ashley, and I've been living with multiple sclerosis for 17 years. I do have a specialist in Calgary that I see once a year, but multiple sclerosis flare-ups don't work on a schedule. They're unpredictable and sometimes entirely debilitating. That is why it is so critical for me to have access to a family doctor, one that understands my diagnosis and my care plan. Despite being registered with a local family doctor, the strain on the healthcare system and the lack of family doctors in our community means it is nearly impossible for me to get an appointment. Walk-in clinics and emergency rooms have extremely long wait times, and as someone who is immunocompromised, that is not somewhere I feel comfortable seeking care, especially during the pandemic. Under the UCP government, I have experienced additional barriers and longer wait times to see a doctor. While slashing of healthcare funding and their war against doctors has caused an exodus of medical professionals from our city, and it's patients like me that are suffering. I would like to see our province return to a place where people and their health are cared for and cared about. The push for privatization must end. The MS community is a tight one, and I've spoken to patients who live under American-style healthcare. We cannot go in that direction. It leaves people like me abandoned.
Thank you, Ashley, for those very good points. Families in Medicine Hat need to know that they have a doctor to support their health and their well-being. So I'd like to introduce Holly Turnbull, who is a mother of 4, to speak about the impact of the family doctor shortage for her and for her family.
Okay. Thank you, Rachel. Okay, and also thank you so much for coming to Medicine Hat. I've lived in Alberta for the last 12 years. First in Calgary, then we moved to Cypress County, just outside of Medicine Hat. During this time, our family has experienced great joy, significant loss, the floods and fires, work struggles, family shifts, and today my husband and I continue to build a life in this treasured community with our kiddos. Over those years, we've relied mostly on walk-in clinics and more recently on telehealth, but these are only band-aid solutions. Our story is not unique, and this morning I'm holding many others in mind who have struggled navigating this system. Sorry. I can't speak on their behalf, but if they're listening, my apologies. Just know that you're in my heart today, and you know who you are. With 4 kids, we need a regular doctor for all the health issues that will come up, from concussions to car accidents, dealing with asthma, mental health. When we needed a doctor, often there was either none available, none accepting new patients, or if we did have a family doctor, there were no available appointments in any kind of time frame that would be supportive. Because of this, years will pass without seeing a doctor for many in our family, and that means regular annual checkups just don't happen. We rely on walk-in clinics for prescriptions, to address things like asthma, allergies, and other regular ongoing medications. But it's curious if you ask yourself how much medical history can a walk-in doctor really get in a 10-minute appointment if we're dealing with a biopsychosocial approach to healthcare. I am personally stuck in the WCB system right now, trying to develop a return to work plan. This process has been significantly impacted by the lack of available physicians and specialists. Earlier this year, I had a specialist refer me back to my family doctor after waiting 7 months for that appointment due to the significant administrative burden of treating patients in the WCB system. With recent changes to human rights, occupational health and safety, and workers' compensation legislation, my experience trying to navigate the system has been dizzying. We have considered leaving Alberta because of the wholesale lack of support for families. Raising humans in today's society requires a robust healthcare and an education system, adequate social supports. I'm concerned for the future of our children, as are many other parents in this forgotten corner of the province, but today not so forgotten. I'd like to see elected officials stepping away from earplugs and instead lean into some healthy, constructive discourse. We need leaders who listen to others, who work to find solutions. Our doctors need support. They need a system with a work-life balance where they feel respected. And I know that it's not only our doctors that need to be supported by the government, but given the impact that the lives of so many, that they have on so many in our community, this would be a great start.
Thank you very much, Holly, for those comments and for your perspective on how this has impacted you and your family and your friends. So we've heard from other people who live in Medicine Hat who were unable to join us here today, but who wanted us to also highlight their stories. Like Sam, a 30-year-old nurse and cancer survivor who has been without a doctor for over a year. For her, not having a family doctor could literally mean the difference between catching a cancer recurrence early. Or Gary, a 45-year-old fellow from Medicine Hat who, like many in the community, relies on the walk-in clinic. And with a back injury and a WCB claim, Gary needs ongoing appointments, not one-off visits. These are real people, and they are suffering from the consequences of the UCP's bad choices. There is a better way, and I will lead us in that direction should I become Premier of this province in the next election. We need to bring real resources to the front line in our hospitals and our ambulance. Most importantly, we need to rebuild a relationship of trust with all of our healthcare providers on the front line. Medicine Hat should be an attractive destination for family doctors, quite honestly, from across the country and around the world. I mean, look at this weather. More importantly, young Albertans born and raised here should be able to access medical school and want to do their residency here and then launch their practices here. Now, money is part of that, but when a doctor is deciding to move or deciding where to move their family and start their practice, it's also important for them to know that they have a government that respects their profession and respects the system within which they work and the objectives that they make so many sacrifices to achieve. And that is something that is missing right now. We have a lot of challenges ahead to repair all the damage the UCP have inflicted on our healthcare system. To be successful, we must work collaboratively with the folks who are actually at the bedsides, in the ambulances, and in the clinics delivering care. And Alberta NDP government will do exactly that, and we will work hard to make sure that families in Medicine Hat get the care they need in their community. Albertans know that they can trust Alberta's NDP to focus on restoring and protecting the healthcare system that they and their families so desperately need to be put there for them. Thank you, and we'll be happy to take any questions you might be having.
So we'll start with some questions here in person before moving to the phone line.
Perfect. Hi, Ms. Notley. Gates Gorin with Chat News here in Medicine Hat. First question really is, I think a big thing is recruitment and retention of physicians. So if the NDP were to be elected next May, what are some initial steps for your government to both recruit and retain physicians here in rural municipalities?
Right. So we know that the issue of physician recruitment and retention is a complex one. And we also know that we'll be in competition with provinces around the country, as we always have been. So there are specific things where we would work with the communities and the city councils and places like that to come up with particular programs. But overarching, here's where we need to start to make sure that doctors look to Alberta as a place that they want to live. First, we must re-establish the relationship of trust between the government of Alberta and all frontline healthcare professionals, especially doctors. Secondly, we must restore stability to our healthcare system. We cannot engage in an ever-ending ideological experiment at destabilizing and finding new and exciting ways to privatize our healthcare the way the UCP is so determined to do. Most doctors look at that and say, no way, not going there. The third thing is we have to fund our system appropriately. Alberta's healthcare system has had a lot of money pulled away from it in the last 3 years. The UCP has not been terribly honest about it, but when it comes to the money that people managing healthcare can count on having in order to do the kind of planning that's necessary to do the recruitment and retention, that amount of money has been considerably reduced under the UCP. And so we must reverse that. We must create a stable, predictable funding model, an adequate funding model that can attract people here, and then we need to engage in that respectful conversation. All the while working with individual rural communities and leaders in those communities to find the kinds of solutions that will help grow access to healthcare in the community.
Do you have a follow-up?
Yeah, just a quick follow-up. So just speaking with members of community, healthcare professionals at walk-in clinics, obviously they want physicians here yesterday, years ago. So what is the NDP caucus going to do now to challenge the current Alberta government to try and attract or to bring in physicians as soon as possible?
Well, I mean, we're going to continue pushing them in the way we are, frankly, today, in terms of highlighting this issue, making sure that the stories of Albertans who are suffering the consequences of the chaos that their decisions have created are told, making sure that they understand that this is one of the most important things that the provincial government will ever do. They are failing it. They are failing families, they're failing people like the folks you heard about from today. And so we need to tell that story and raise those voices and continue to push this government towards a path of actually fixing our healthcare instead of constantly looking for new and exciting ways to blow it up, which is unfortunately the primary focus that this UCP government has chosen over the course of the last 3 years.
We have one more set of questions before we go to the phone line.
Samantha Johnson with the Medicine Hat News. I understand that the privatization contracts that the UCP has given out are long-term and can't be reversed, or do I have my information wrong?
I think that every contract is different, and we would certainly look to reversing as many as we could. Let me be clear, their plans to the small movement that they have made with respect to the privatization is going to have a negative impact on our overall public healthcare system. We know that the primary problem is having enough frontline healthcare providers. Setting up a private model in the middle of a public model to compete with the private model is a recipe for disaster, and there's not an expert in the world who doesn't agree with that. I suspect that we will have some capacity to reverse those contracts. Each one will depend how far along they are and what the contracts are. But let me be very, very clear. We will do everything we can to stop those contracts, and we certainly, to goodness, will not move forward with any of them. And any new ones. Yeah. Sorry. Yeah.
So I understand that the next contract to come up is the privatizing of the labs. And do you have any insight into how that's going to affect the overall system?
Well, so the lab is one of the more complicated ones because that one's probably the farthest along. Now, when we were elected, the privatization process was in process. We reversed it. We made a commitment to build a public lab, and let me just be clear, if that lab had been built, there were actually shovels in the ground at the time. Thousands of people lost their job when the UCP canceled it, and we also lost tremendous opportunities for economic diversification that would have come from the consolidation of the expertise in Western Canada within that lab that would have been created by our investment. So it was a tremendous loss. Going forward, the problem with privatizing labs is that as the public sector gives away testing capacity, the next time you go to negotiate the next contract with the private sector, at that point you're over a barrel and the costs start to go up, 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 and the access to the testing goes down, down, down. So it is, and it further fragments and delays work within our public sector. So it is a bad idea. We don't know what the current contract looks like. We don't know how far along it is, and we don't know exactly the path to undoing the damage. But we will certainly make that a focus to try and do as much as we can in a cost-effective way, because it's part of our public health system. Testing and diagnostics is a critical part of our public health system, and we need to be able to have that work as efficiently and effectively as possible across the province.
So we'll now move on to the phone lines. Our first caller's line is open. Go ahead, state your name and outlet, and ask your question.
Lisa Johnson from Montreal. I have a topic question for my colleague. I'm wondering if you can comment on the announcement yesterday that Minister LaGrange is bumping diploma exams to 20% of the weighting for students this school year. It goes up from 10%, but it's not back to the 30% yet. Do you have any thoughts on that?
Well, we have heard from parents, from students, from teachers that the weighting on the diploma exams should go down. It should not be going up. She may not be going up as fast as she had originally planned, but the whole idea of going up that much, particularly given the level of instability and change and challenges that have existed within our high school systems over the course of the last few years, is unfortunate. So it's good news that they're not going to 30, and I'm sure some people will breathe a sigh of relief there. But I think a lot of other people would have liked to have seen them stay at 10. And at a time when there are so many parts of our K-12 education system that are struggling to deliver the kind of education to our kids that we hope to have them receive so that they can have the best start in the future, at a time when those offers are so challenged because of so many poor decisions taken by the UCP, that is not a time to actually ramp up testing. Quite the opposite. They should be ramping up resources, ramping up supports, and delivering a better quality of education.
Lisa, do you have a follow-up?
Yes, thank you. Sorry, my audio seems to be cutting over the unrelated follow-up. I'm wondering what your thoughts are on the government that their natural gas rebate is not going to kick in October because the monthly default rate is expected to be is set under that 650 trigger per gigajoule. I'm wondering what you think of the details that were released yesterday, the fact that it's not going to be triggered in October, and how you feel like this might help or not help Albertans. It appears to apply to most every consumer in Alberta, so I'm just wondering what your thoughts are on that program.
Well, I think that the rebate program in and of itself was always a drop in the bucket and didn't amount to the kind of support that Albertans needed given the pressures they are facing. And let's, if you add that to the fact that they're planning on phasing out the elimination of the gas tax, or put another way, phasing back in the gas tax this fall, what it shows to me is that we have a government that is literally not talking to regular families about what it looks like to sit around the kitchen table at the end of each month and figure out how they're going to pay all the bills. We know that power rates are going to be the highest they have been in the history of this province over the course of the next 4 months. We know that grocery prices are the highest that they have ever been, and they are not coming down, even though inflation driven by gas prices is mediating a bit. So we know the actual experience of Albertans is that they're still struggling, and yet this government seems to be rushing to pull back the very limited support they offered at a time when folks are going to need that support more, not less. And what that says to me is that we have a government that literally has been so focused on talking to themselves in their own internal drama, they've failed to actually sit down and talk to regular Albertans.
Thank you very much for the questions, Lisa. We'll move on to our next caller. Tom, your line should be open.
Hi, Rachel. Thanks for taking my question. Sorry, it's another off-topic one. I want to get you on another note from yesterday, and I got late, so I'm sorry if you already addressed this, but it was on the province refusing to provide any resources on the federal gun legislation that's coming forward. Politically, what do you make of this? And can you tie this at all to launching a provincial police force? Do you see anything in there about political policies and not wanting to move forward on certain aspects, not going through the RCP, but through a provincial police force?
Listen, I mean, this is a government that has made decisions on the basis of politics, and primarily politics in relation to the federal government, that very rarely has anything to do with the best interests of Albertans. We know that, and we know this not from politicians in Ottawa or different politicians in other provinces, but from the chiefs of police across the country, that one of the critical ways we can improve public safety across the country is to reduce the prevalence of military-style assault weapons in our communities. Hardly groundbreaking stuff. What we know as well is that the number of shootings in Calgary are on track to be the highest ever. We know that in Lethbridge, shootings are happening at a much more consistent rate. And so at a time like that, what we need to be able to do is focus on wise steps that will ensure public safety. And yet this UCP government is playing cynical one-off politics with the safety of families and their kids and all Albertans in their communities across this province.
Do you have a follow-up, Tom?
Yeah, do you think RCP resources should be, as the UCP describes it, taken off the streets and put towards confiscating or seizing guns that are not done?
Again, as I say, I think what needs to happen is there needs to be a reasonable conversation about the best way to secure public safety. These issues are about taking military-style assault weapons off the street. So to me, that sounds like a pretty important strategy to improve public safety. And quite honestly, that is not what's driving this Alberta government's decision-making right now. It's crass, self-interested politics, and that should stop.
All right, one last pass for questions online and in person. No more questions today. That will conclude the press conference. Thank you, everyone.
Thank you very much.